The Grippable is a handheld and portable assessment and rehabilitation tool for recovery of upper limb and hand function. It's really easy to use and set up, and clients can use it with us here in the clinic and also at home. The device is wireless and links to the tablet, and this allows us to create a secure patient profile for each of our clients. We can use the Grippable to record grip strength and range of motion in various movements of the hand and wrist. From the assessment, we can then help patients work on particular movements that are pertinent to them. The Grippable is calibrated to their current level of function, and you work through levels. Clients report it's challenging, fun and rewarding. We use the Grippable with a wide range of our neuro clients, from stroke, brain injury to spinal cord injury, and also those with ataxia and coordination problems. The Intento is an innovative way of delivering electrical stimulation to help recovery of upper limb and hand function. The device is operated by the client themselves, who modulate the intensity and speed of the electrical pulses by a handheld dial. Your physiotherapist will assess your upper limb and decide which movement patterns to work on, then place electrodes on the skin which will deliver the electrical pulses. The speed of the pulses will be determined by you turning the dial. The tablet helps us monitor progress and gives visual feedback on the use of the device. The benefits of using the Intento are it gives high numbers of repetitions of functional movement patterns with the electrical stimulation. Your therapist will help facilitate those movements and make them appropriate to you. The client groups we use the Intento with are primarily brain injury and stroke. It's indicated clinically to use with those with moderate and severe impairment. In clients that undertake a programme of sessions with the Intento, we notice improvements in their muscle activity, the sensation in their upper limb. We also notice in those who have high muscle tonal spasticity that the tone reduces. Clinical trials show the use of Intento is more effective than standard therapy alone. It can be used with those with severe to moderate impairment of the upper limb after stroke and brain injury.
So at PhysioFunction we work with the MindMotion Go system. Now this is a virtual reality based system that monitors the patient's movement through a Kinect sensor, and then it provides gamification of rehabilitation exercises to try and maximise their function. So we can use the MindMotion Go to perform some upper limb and whole body tasks to try and get the whole body working in unison, trying to get more postural stability, more postural control, more balance, and to, again, maximise the functional ability of the patient using the device. So our patients really enjoy using the MindMotion Go. It links gaming with exercise and physical rehabilitation, so it really enhances their motivation to engage. You're working on a kind of score system, so they're always working to try and beat their scores, and it's generally a competition within themselves to try and really optimise what they can do on those individual games, and they're all tailored to an individual level of ability. And in addition, we can add cognitive elements to it, so the higher difficulty that we work at within each exercise, the more cognitive engagement there needs to be from the patient, so it can work both from a physical and a mental rehabilitation standpoint. We're able to use the MindMotion Go with a very wide range of patients, so if they can stand, we can do balance and mobility exercises, and if they can sit, we can do seated stability, postural control, upper limb function, so a huge range of patients. We can even use sort of standing aids to enable them to be in a more upright position to give them a greater level of challenge. And we would expect to see improvements in their balance, improvements in their reactive stability, improvements in their mobility, and also just increasing their daily function of being able to use, let's say, use an arm to reach up into a high shelf because they've got more stability coming through their middle. It can have a really positive influence on their mental health and their emotional well-being.